This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about the recovery difference versus a corticosteroid injection versus a PRP, platelet-rich plasma injection. If you like this video, we put out new content weekly, so please like and subscribe. So for joint pain, tendinitis, arthritis, that sort of thing, there's different options that are not surgery. One of them is commonly known as a corticosteroid injection. It's a corticosteroid, which is on the other side of an anabolic steroid. So anabolic builds muscle, corticosteroid decreases inflammation. And what you're really doing is you're putting a really strong anti-inflammatory in some areas. It's good for tendinitis and other sorts of things. It works well. PRP is platelet-rich plasma. Basically, almost like when you get a cut and you can heal it, you can see that process. You just take the same sort of mechanism, the platelets, and you super concentrate them, and you inject them into somewhere. And that's called platelet-rich plasma. And that falls into the category of regenerative medicine, and it decreases inflammation, but it can also sort of act to repair smaller structures. It can't like fix a massively torn rotator cuff or repair a labrum that's like totally detached. It's not going to regenerate cartilage, but it has some level of regenerative properties. So you may have heard your doctor talk about one versus the other. So obviously there's cost difference and all the other things, but what about the recovery? So the recovery is fairly different. Normally with a corticosteroid, there's lidocaine mixed in, and that'll sort of numb things up. So after the injection, you might feel actually better. And then the steroid takes about 2 days to start working. So normally the numbing medication wears off in a few hours. The next day, you may feels like it didn't work usually, and then the day after it starts feeling good. So normally within 2 days, and sometimes it takes up to a week, but mostly within 2 days, you're usually feeling much better than you were before. PRP is different. PRP kind of creates an inflammation-like process. So after you inject somebody with it, normally we don't mix it with lidocaine because it can damage the cells. It normally causes a lot of pain. So after someone gets injected, normally they'll feel worse for like 1 to 2 weeks. So if they're used to getting steroids and feeling great after a couple days, PRP, they're definitely feeling worse for a couple weeks. And PRP has a slower onset of action. You're talking about a month before it starts working, and it maxes out at about 2 to 3 months, depending on where you had it. So a lot of times you get a PRP injection, it feels worse. After a couple weeks, kind of goes back to the way it was. And then it takes a few more weeks to say, hey, this is starting to feel better. The upside, I'll say, is that along with the regenerative properties, I find it more powerful than steroids. So usually, depending on where it's done, you can end up feeling a lot better than you would have, and it can last a lot longer than if you were to get a steroid injection. I tend to tell my patients that it's somewhere between a steroid injection and surgery, meaning that it's not the super quick fix like a steroid injection, but also the recovery is not quite as long as surgery, even though right afterwards it might feel like you just had surgery on whatever joint was injected. But that's pretty much the recovery time. Corticosteroid quick, PRP takes a long time. The effect, usually steroids less, PRP regenerative properties, in my hands, tends to work a little bit better. So I hope I was able to answer your questions about the recovery time of a steroid injection versus a PRP injection. If you have any questions I didn't answer, feel free to leave them in the comments below, but I can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only. Thanks for watching.